Kristen Melton, and this is my informative speech. Today I will give you a basic overview about pediatric cancer. I have always enjoyed the current research of pediatric cancer and find the subject very interesting. There are many risk factors, types, and treatments available if your child has been diagnosed with cancer. In discussing the basics of pediatric cancer, I'll explain in 3 key points how to understand what cancer is, the different types of cancer, and treatments available. Now we're going to go to a PowerPoint for a basic understanding. All you need to know about pediatric cancer. Pediatric cancer is an unfortunate disease that affects children in today's society. According to the National Cancer Institute, the understanding of the symptoms, types, and facts about this disease can be critical. The understanding of cancer. A risk factor is anything that changes your chance of getting a disease such as cancer. According to the American Cancer Society, the lifestyle-related risk factors have an effect on adults. Research shows childhood cancer is different. Cancer is caused by a mutation or a change in a gene. DNA carries the instructions for nearly everything our cells do. DNA affects everything in our bodies, including our own risk to get certain diseases, including cancer. However, most cancers are not caused by inherited DNA mutations. Most cases of childhood cancer is caused by an acquired mutation. An acquired mutation starts with one cell, and then that cell passes the mutation on. Now that you understand what cancer is, we're going to go over some of the common types. Leukemia. Leukemia is the most common case of pediatric cancer. Leukemia can cause bone and joint pain, weakness, bleeding, and weight loss. According to the American Cancer Society, leukemia accounts for 33% of childhood cancers. Brain and nervous system cancers. Brain and nervous system cancers are second most common. Most brain cancers in children involve the cerebellum or brainstem. In early stages, these cancers can cause headaches, nausea, vomiting, blurred or doubled vision, dizziness, and trouble walking. Spinal cord cancers are less common than brain tumors. This accounts for 21% of childhood cancers. Neuroblastoma. Neuroblastoma is the most common solid tumor in children. It is often found within the first year of life. This type of cancer usually occurs in the abdomen and is noticed by swelling. It can also cause bone pain and fever. It accounts for about 7% of childhood cancers. Bone cancers. Primary bone cancers start in the bones and occur mostly in young adults. There are many types of bone cancers. Now let's discuss some of the ways to treat cancer. Treatment. Treatment options may include chemotherapy, surgery, and radiation therapy. And although there are some exceptions, childhood cancers tend to respond very well to chemotherapy because their cancers grow fast. Most forms of chemotherapy affect only cells that are growing. The cancer treatment team consists of pediatric oncologists, surgeons, radiation oncologists, pediatric oncology nurses, and even psychiatrists. Most children are treated in specialized treatment centers for children. Most are connected to a university or even connected to a children's hospital. Surviving childhood cancer. 5-year survival rates vary depending on the type of cancer the child has. Compared to a survival rate of less than 50% in the 1970s, according to the American Cancer Society, today the survival rate is greater than 80%. With the help of friendly doctors and nurses, together families can get through this difficult time. Now we're going to look at some graphs or pie charts. These are available on all these websites up here: cancer.org, nccn.org, and cancer.gov. This one here is just describing the different types of cancer broke down into percentages. And this one is pediatric cancer diagnosed by the age group. As you see here, most pediatric cancer is diagnosed before the child is 5 years old. To summarize, after dealing with the diagnosis and treatment, you must be prepared for a lifelong process of follow-up care. Now we know that there are many risk factors, types, and treatments available. We can just understand how serious cancer is. Researchers all over the world are looking for better ways to prevent, diagnose, and treat childhood cancer. The American Cancer Society, the National Cancer Institute, and the National Comprehensive Cancer Network, all three are working together for a better understanding of pediatric cancer. You can visit these websites for more information. Thank you for listening.